Hello everyone and welcome to a brand new segment of Insights by Dr. Azad Moopen. A few terms are spoken very often these days in order to manage or deal with COVID-19 pandemic. Let's explore that today. Doctor, we are often hearing about scientists and researchers mention that the peak in the outbreak is yet to come and that we need to take maximum efforts in flattening the curve. Could you please explain to us what is peaking or flattening of the curve in COVID-19? Along with that, what is surge capacity?
The three terms that we have been hearing constantly in the COVID days are the peaking, the flattening, and the surge capacity. So what is peaking and flattening of the curve? It's very simple. It's when the number of cases increase and reaches a peak and then starts coming down. So the effort is to flatten that. If you have a very steep mountain and if the peak is attained very quickly, that means you will have huge issues at that peak and you won't have the required capacity to cater to the people who are required, especially the acute patients and the terminal patients. It's very important that you have the capacity with people as well as equipments. So in this situation, what is being done is to reduce the peak or flatten it by way of having this spread across. If you are getting illness, if you are getting positive cases, try to have it over a period of time rather than having it in a spurt in a particular point of time. This is what is being done through the various methods like social distancing, quarantining, and lockdown, and all that is seen in everyday life. So this helps in flattening of the curve because people don't get infected in a sudden spurt. And that helps in controlling the sudden spike or the peaking. So as people who are involved in this spread, everyone has a responsibility to cater to the requirements of whatever we all know about the hygiene, respiratory hygiene, as well as all the controls which have been put in by the governments. This will help us to flatten the curve much more, and that will help the medical profession to provide better care to the patients who are severely ill and critically ill. Now, surge capacity is related to that. Like what I said, when there is a surge, there has to be a surge in the area of supply also. The demand is high for medical care, so the supply also has to increase. So what are the important things? One is the number of people, doctors, nurses and all who are available for that. And the second is the medical supplies like the PPEs as well as the ventilators. And the third one, of course, is space to hold all this. So the three S which are there. One is the space required. The second is the medical equipments and supplies. And the third one is the staff, the doctors and nurses. So what we have found in countries which have failed in containing it effectively, like maybe it is Italy or Spain or America, you will find that the surge capacity was not built and there has been a sudden peak, which led to a breakdown of healthcare facility being provided. Whereas many countries which managed it very well had the minimum number of casualties and deaths. There are many examples, and one of the very good examples that is being quoted world over is about the state of Kerala, where we had the least number of deaths and the peak was not attained even, and we flattened it off, and that is being quoted. There are other countries which have done that. New Zealand is another example, or if you look at even Singapore or South Korea, and that is how we can flatten and also increase the surge capacity. This way, we are able to contain this COVID in a much better way and reduce mortality as well as morbidity.
Each of us are responsible to take the appropriate measure to support our countries to flatten the curve. Only through a collective measure to break the chain can we flatten the curve and control this pandemic. So keep your hands off your face and stay safe.